Well, welcome everyone to another Wednesday evening lecture, the National Fellow Online Lecture Series. Again, this is sponsored by the Fellows Online Education Subcommittee, the AMSSM Education Committee, and the AMSSM Fellowship Committee. Tonight's topic is how to sleep like a champion, going over sleep and the athlete. I'm Dr. Lee Mancini, the Chief of the Division of Sports and Exercise Medicine from UMass. And tonight I have the pleasure of welcoming and introducing Dr. Cheri Mah. She is a sleep physician and adjunct lecturer at the Stanford Sleep Medicine Center. She is board certified in sleep medicine, having completed a fellowship in sleep medicine at the Stanford Sleep Medical Center. She's also board certified in internal medicine, having completed internal medicine residency at Kaiser San Francisco. And over the past decade, her research has focused on the relationship between sleep and performance in elite athletes. Dr. Mah consults with professional teams in the NFL, NBA, NHL, Major League Baseball, as well as international sports organizations on optimal sleep, travel, and performance strategies. She has worked with professional teams such as the world champion Golden State Warriors, San Francisco Giants in Major League Baseball, San Jose Sharks, Super Bowl champion Philadelphia Eagles, the Toronto Blue Jays, among other teams. So it's really my pleasure to have her here tonight as one of the leaders in sleep science and sleep performance to give this lecture. Upcoming lecture next week will be high yield ultrasound for the CAQ by Doctors Emily Dixon and Ryan Cruz. They'll be giving their talk next Wednesday evening at our usual 8:30 p.m. Eastern Time, 5:30 p.m. Pacific Time. So as a reminder, this lecture serves as an adjunct to your individual program's educational programming. The goal is to provide fellows with direct access to educational experiences with experienced AMSSM members and at times invited guest experts, such as Dr. Mah, in a variety of formats, and to assist in the CAQ exam preparation. Just a reminder to all the participants joining us, please mute your microphone and turn off your video. Submit questions through the chat function and include your name and program if you wish. I'll be monitoring the chat as well as Dr. Mah, and then we'll ask some questions based on the questions you submit at the end of the lecture. Also, as a reminder, after the lecture and the program, please complete the evaluation, which can be submitted and seen at the end of the lecture. With that being said, I'm going to stop sharing my screen and turn things over to Dr. Cheri Mah, and we all get to learn how to sleep like a champion.
Okay, well, thank you. I am Dr. Mah. I'm so excited to be here this evening with you to share with you how to sleep like a champion. Today, I hope that I can share with you some of my applied work, as well as research working with elite athletes into helping you figure out ways that can be strategies to talk with your athletes about sleep, to know when you should refer athletes to a sleep clinician, and really just to help your athletes learn about sleep in a way that is really such foundational to how they're going to be able to be their best, whether it is on the field, whether it's just to be their best day to day. So with that, let's get started. So these are my disclosures. I do serve as a consultant to a number of professional sports teams and some sports organizations. I also serve as an advisor to some startup companies and fund. Okay, to give you a quick background, so I have been affiliated with the Stanford Sleep Center for about almost over 20 years. My research has been really focused on how sleep impacts performance in elite athletes. And I got fascinated with this area as an undergraduate at Stanford and really dove into what are the positive interventions that possibly could have benefits on performance outcomes. As you heard, I am board certified in internal medicine and sleep medicine, as I made a later career decision to come back for that, having done research and work with athletes. And some of my research has been based at the University of California, San Francisco, at the Human Performance Center. It's a biomechanics and exercise physiology lab. And over the years, I also started to partner with a number of organizations to really apply that science into practice. And along the way, have had the unique opportunity to work with a number of professional sports teams. So have a couple of here, helped the Eagles win the Super Bowl in 2017, 2018. And along the way have had some, very unique opportunities to try to apply what we understand on the sleep and circadian science into practice. So hopefully that gives you some more of my background and where I come from. Today, where we're going to go, I want to first talk with you, what's the impact of sleep on your performance, health, and even injury risk? I want to arm you with sleep assessments and tools to be able to talk with your athletes more about their sleep and also establish when you should actually refer potentially to a sleep specialist. And then I want to dive into 8 practical sleep essentials to help both your athletes as well as hopefully you to sleep like a champion. And within that, how you can leverage various sleep tools that have now become quite prevalent over the last 10 years, whether with technology or other tools that you can use at home and on the road. And lastly, I'll leave you with some sleep resources. Okay, to get started, let's first I want to introduce you to Andre Iguodala, who is someone who asked for help with his sleep when he first came to the Warriors in 2014. And I introduced him to you because this may resonate with you on how some of your athletes may or may not be sleeping. But he is someone who came to the Warriors at 28, and he knew that he wanted to extend his career for as long as possible. However, he knew he wasn't sleeping well. He would stay up till 4 in the morning playing video games, play for a few hours, go to practice, come home, take a 2 to 3 hour power nap. And this was his typical schedule for 10 years since college. And so I was connected with Andre. We restructured how he approached his sleep, and I'll share with you what that looked like. But along the way, there was a third party that tracked his performance stats. And just as an example of what it can mean to be at the highest level, but finally have a foundation of adequate and healthy sleep each day, as we went from under 7 to 7.5 to 8 hours of sleep, his 3-point percentage went up twofold. His points per minute went up 29%, and his free throws went up 8.9%. His turnovers went down 37% and his fouls went down 45%, right? So these are actually huge gains. And it wasn't the 1% that a lot of our athletes are looking for in various aspects of their training and practices. This we're starting to show could be as big as 9% or even double digits, depending on the outcome. And so this is just one example of what can mean when you actually have that critical sleep that is each and every day throughout a long season. Okay, so I want to reframe how you think about sleep. So sleep is not the end of today, it's the beginning of tomorrow. And I want you to think about that so that we become more proactive about prioritizing our sleep than often, which is the current state, which is being reactive whenever we decide to jump in bed and sleep happens. So think about sleep as not being the end of today, but it's the beginning of tomorrow. And it's going to affect every aspect of how you perform, how you interact with your colleagues or peers or teammates, and ultimately how you function and whether you're able to be at your best that following day. So to start us off, easy question. How many hours of sleep do you think adults minimally need every night? So do you think it's under 6? Is it 6 hours, 7, 8, 9, 10 hours? Take a guess, throw it into the chat. I do have my chat up to see what you guys think of what is the minimum amount that is recommended every night for an adult. Or you can come off mute and share with the group. Do you think it's 6, 7, 8, 9, 10? I'll give you 30 seconds here to take a guess. Okay. All right, so hopefully you've given a shot at what you think it is. The answer is actually 7 hours. So 7 hours is what is recommended by a consensus panel in 2015 by the American Academy of Sleep Medicine and the Sleep Research Society. And that's actually the lower threshold. So that's the minimum requirement that you should really be aiming for as an adult, but there's no actually upper limit, and there's variability between individuals. So you may actually need 8 hours or 9 hours to feel well rested during the daytime. And there are certain situations where upper end, such as 8, 9, 10 plus hours could be appropriate. Elite athletes is one example, as well as younger adults who might have an accumulated sleep debt. And so there is no actually upper limit any longer. Okay, the reality though is that many Americans are not getting sufficient sleep, and it's really not a priority. So we can even see that increase in the number of American adults that are getting under that 7-hour threshold over even that 10-year span from 2010 to 2018. And we see that now at around 35%. Unfortunately, amongst healthcare workers, as you might have experienced, we are amongst the highest percentage of the workforce that are having high levels of sleep loss. Police also have a high percentage of 50%. And we just know that a tremendous number of Americans, estimated to be around 70 million, suffer from chronic sleep problems. When we look at what is a priority for individuals when they're planning for the next day, it really ends up being fitness, nutrition, and work are higher priorities. Sleep, unfortunately, only about 10% really make that a priority for the following day. And when we look at how this may appear for student athletes, I did a study where I looked at all the student athletes, as many as I could at Stanford. I was able to grab about 628 and be able to assess what their habits look like. And approximately 39% of them are getting under 7 hours of sleep on weekdays. As recent as this year, when I assessed one of my professional sports teams, about 43% of them were falling under that 7-hour mark. Now, when we look at what that translates to levels of daytime sleepiness in the daytime, about half of them have clinically high levels of daytime sleepiness, suggesting that they may not actually be getting sufficient sleep, even if you are hitting that 7-hour mark. And then 62% are often or always tired. And then the contrast to how much they know that they need is quite substantial. There's about 74% of them that say they know they need that 8 to 10 hours plus to perform optimally, but clearly they're not following through and able to obtain that on a regular basis. And it's not just about sleep quantity, it's also about quality. So we see about 42% of them will be classified as having poor sleep quality as assessed by the Pittsburgh Sleep Quality Index. Okay, so taking a step back, what is happening with our sleep? We go through these sleep cycles. This is hopefully a refresher for many of you, but we go through these sleep cycles through the night. You go into what's termed now N1 and N2, which is our light sleep, and then you go into deep sleep. Now it's termed N3. After that, you cycle into your rapid eye movement or REM sleep, and that's when most of our dreaming occurs. Now you go through these cycles through the night, but not each is equivalent. As you can see, you get actually more of your deep sleep, the light blue, in the earlier parts of the night, and that's really critical for muscle repair, regeneration. And then as you go through the night, you progressively get more REM sleep. And that's considered important for learning and memory consolidation. And you can imagine that if you're not getting, say, your typical 8 hours of sleep, but you truncate that sleep and you only get, say, 6 hours, you're probably going to be cutting out a cycle, maybe almost 2. And what are you going to be cutting out at that point is largely going to be rapid eye movement sleep, because we, again, predominantly get that in those early morning hours. But that's so critical for example, memory and skill consolidation. Okay, now sleep changes through the ages. And so you can see as you go from infancy into preschool, age school, teen years, and then into adulthood, the sleep needs decrease gradually. As many of you who have children can note that they're getting many more hours around sometimes, 11 to 14 when they're toddlers. At the teenage years, they really should be in high school getting around 8 to 10 hours, but oftentimes even our young adolescents are falling short of that. And then as an adult, we're typically, as we've talked about, around 7 to typically 9, but it could be extended higher as well. Okay, now when we think about why we're talking about sleep enhancement, it's because we are starting to recognize that it can be a competitive advantage for our athletes, and it's so critical for peak performance. Now, I break this down into several domains. We recognize that when we improve sleep duration, our approach to sleep, the quality and the timing, On the cognitive domain, we see faster reaction time, better decision making, improved learning and memory. You're able to make good decisions and have good judgment calls when it matters. On the physiology side, we need a healthy, injury-free athlete. We'll get into this in a bit, but for example, having a properly functioning immune system is going to be key to keep these athletes healthy. And that's fundamental to have sufficient sleep under your belt to do so. And then on the physical performance, we see that with sleep enhancement, you get faster reaction times, faster sprint times, improved fatigue, improved accuracy. And each of these domains are obviously critically important to combine, and really it's going to be the combination of these domains to peak when it matters. We're approaching the Paris Olympics this summer, and so really you want each of these domains to be supported as best as possible to give yourself the best chance to be able to peak when it matters. Now, on the flip side, we unfortunately see not many great things come out of getting chronic sleep loss or having circadian disruption, because it really can impair health and performance. To highlight just a couple of these areas, we know that insufficient sleep can affect submaximal and maximal lifting in the weight room. We understand that there's this bidirectional relationship where sleep and mental health are intimately intertwined, specifically poor sleep can lead to worsening of mental health issues, and then vice versa. Some of my work has looked at how sleep loss can impact biomechanics and possibly also lead to an increase in injury risk. We understand that there's an impact on your hormonal regulation. So for example, leptin and ghrelin that are going to be influencing your appetite and weight can be dysregulated with insufficient or disrupted sleep. We see higher inflammatory markers with chronic sleep loss. For the men, testosterone can drop in even several days of insufficient sleep. So 10 to 15% over even 5 days in young, healthy males is substantial. As you age, it really should only be a loss of about 1 to 2% per year. So simply having insufficient sleep can age you almost by a decade. So if you're a healthy 20-year-old, you have the levels potentially of almost a 30-year-old. And then when we think about also circadian disruption, there's been studies to show how that can impact performance outcomes, specifically in the NFL and NBA and Major League Baseball, which we can get to. Okay. Now, specifically in the cognitive domain, this is one study I wanted to highlight where if you are someone who is getting 9 hours of sleep, your reaction time in this box is 1 week will stay stable. This is this top line. If you're someone who's getting 7 hours of sleep, you see the slower reaction time and then a leveling off. If you're getting 5 hours, you see the slowing again, more pronounced, and a leveling off. And hopefully no one here is getting 3 hours of sleep, because that will just see this progressive decline over a week. Now, the important part here is if we give you 3 nights of recovery sleep where you get 8 hours time in bed, you do see this improvement in reaction time, but the most important point here is that it doesn't rebound back to your baseline, even with 3 days of that recovery sleep. So the bottom line is it takes more than 1 night, 1 weekend of really sufficient sleep to make the biggest dent in now what we call this accumulated sleep debt. So I hope this illustrates a bit about how much your reaction time can be impacted and impaired even through 1 week. Now, unfortunately, this can also be equivalent to if you're legally intoxicated. So staying awake for 17 hours can put you on an impairment of about 45 milliseconds slower. And we know in any sport, reaction time is going to be key. Now you might say, okay, that might be 1 day, but what if we do multiple days? And instead of just staying awake for 17 hours, I did look at athletes and said, I will allow you to have 4 hours of sleep a night for 3 days. And interestingly, we saw also this slowing of reaction time that looks very similar, suggesting that it's not total sleep deprivation we need to be worried about, but also it should be alarming that you have multiple days of insufficient sleep. Now, we have to keep our athletes healthy, but something as simple as the common cold, you could be more susceptible to, 4 times more likely to catch that cold when you're getting 6 hours or less sleep versus if you're able to hit that threshold of 7 hours. That's 4 times more likely to catch the cold, which I think is huge. Okay, and sleep loss can also increase injury risk. There are some studies to suggest in adolescent athletes, we see under 6 hours as a benchmark. We see an increase in fatigue-related injuries. But there's also studies that suggest even under an 8 hour threshold, you have a higher risk of injuries at 1.7 times higher versus those athletes that were getting over 8 hours of sleep. Now, what does this look like, for example, in the NBA? I think a study a couple of years ago looked at the density of games. So they looked at back-to-back games. If you had 3 or 4 games played versus 1 to 2 games in the past 5 days. And when you saw the difference, it was about threefold increased risk for injuries, suggesting that that density of game and perhaps the lack of time for proper sleep or recovery time could be influencing this potential injury increase. And that potentially, I think, could have influenced why we've seen this rise of what's called DNP rest. And so when you see in the NBA from 2013 to 2019, and I believe this probably likely continues on this trajectory, we see this rise of the number of games that athletes are missing, not because they're injured, but simply because they're resting, with the idea that potentially it could be helpful to have better rested players at the end of the season or towards playoffs and the most important games that come down the line. Now, to assess and understand, what is happening, why are athletes having a higher risk of injury? I don't think there have been, to my knowledge, any studies that have really looked at the potential biomechanical chains in dynamic movements. And so with the UCSF Human Performance Center, we started to investigate how 3 days of sleep restriction would impact an athlete's biomechanics. And as we do markers on the athletes, and then they do dynamic movements on the force plates, we are able to then reconstruct them and have a better sense of how variable their coordination patterns are. And what we started to show is that in this exploratory study, after 3 days of sleep loss, their joint coordination variability was increased. And so we did a max vertical jump and showed that while they had a decrement in their performance, so they weren't able to jump as high, and they also had a reduction in the reaction time. What we were starting to show is that there is actually more variability in how these athletes were moving, and suggesting that perhaps with this chronic sleep loss over multiple days, their biomechanics are not in their preferred coordination strategy, and perhaps that could have implications down the road. So hopefully more to come, and others will also look at additional sports as well as other dynamic movements. But this hopefully suggests that there could be definitely a change in biomechanics and coordination with that sleep loss. Okay, so let's talk about body clock and travel. When we look at East Coast, West Coast matchups, there have been studies to show that if you simply bet on the West Coast team in these matchups, regardless of the coast that the game is being played on, if it's in a nighttime game, then they'll beat the point spread about 68% of the time. And the reason why this occurs is because there's a circadian advantage to the West Coast teams. They're playing closer to this 4 to 8 p.m. period of the day where performance is enhanced. And that's when, for example, world records are beat. This also has been shown in other leagues. So for example, jet lag impact on Major League Baseball outcomes, particularly with eastward travel. And some sites have dove into what specific performance metrics are impacted in this way. Now, ESPN asked me a couple of years ago, can I predict when NBA teams would be at risk of losing simply because of the schedule? So that means where they're playing, the travel, potentially the loss of sleep. And so I looked at various factors that would influence their travel schedule. And what we were able to show was that in the prediction where there would be, it was called schedule alert, there were 17 worst of the worst games called red alert games. And then you see the gray dots are the other high-risk games. And there was a predicted loss of 78% for schedule alert red games, and then 57% for the remainder. And we were close. 76% were losses and 69%. And in the spirit of this project, strength of team was not factored in. And so this is strictly blinded to strength of team and only based on schedule. Now we did this again for the second year, and now we base this on 10 years of data back from 2007 to 2017. And what we showed similarly to about 78% were losses strictly based on this schedule, which implies not only about the travel and circadian disruption, but that game density, the insufficient recovery time, and several other factors were included. And the bottom line was that we saw once teams were also behind around halftime, definitely into third, and then at any point, they were just often incredibly fatigued and it was hard to be able to come back from that point. Okay, so here's the first case. We have a 32-year-old NFL athlete with a BMI of 38 who reports unrefreshing sleep when he wakes up despite 8 to 9 hours of sleep and is often fatigued in the daytime. You ask him if he snores, does he have brain fog, does he have memory issues? And he reports that he has been told he sometimes snores and he has difficulty concentrating times or remembering his plays. So do you either A, assess his memory with the mini mental state exam? Do you B, instruct him to lose weight and sleep on his side? Do you C, refer him to a sleep specialist for a sleep study? Or D, instruct him to increase his sleep duration to 10 hours because you feel like the 8 to 9 may not be sufficient for him? So go ahead, take a guess. I'd love if anyone was able to give some guesses into the chat. I see a C. Are you doing behavioral lifestyle changes? Are you increasing duration? Are you thinking about his memory issues? Okay, so we got a couple guesses in here. And now you do the stop bang to screen for sleep apnea. So this is just as a refresher. S is for snoring, T is for being tired, the O is for obstruction for stopping breathing, the P is for blood pressure, and then the bang is for BMI, age, neck circumference, and gender. And so you now have a way to risk stratify. If you're at 0 to 2, you have low risk, 3 to 4 intermediate, and 5 to 8 for moderate to severe sleep apnea. And you find out that he is at a 5. So yes, C is the answer here. And as you might imagine, you really want to make sure that he can get connected to an accredited sleep center and have a sleep study so that he can be evaluated for sleep apnea. It is estimated around to be 26% of the population between 30 and 70 years old. So it is incredibly prevalent. One thing I really would suggest is to establish a referral with a sleep clinic. The American Academy of Sleep Medicine has an accreditation verification website. And so I think this is a really great way that you can go and find a center if you don't already have one that is accredited. So you do need to just click this blue box here or else it won't populate for you correctly. And then you can put in your postal zip code. I put the QR code here so you can get to it very quickly or the shortened link. But I think this is a great resource so that wherever you're practicing, you can find someone and a clinic nearby that you can partner with. So I think as a sports medicine doc, it's important to have these partners as part of your care team, because I think you will be leaning on them to be able to have athletes and your patients be assessed for very common sleep issues like obstructive sleep apnea. Okay, and the reason why this may be important to highlight one case study is, for example, Ryan Jensen in the NFL. He was someone who in 2014 was cut from the Ravens. He was assigned the practice squad. The story goes that his mom thought he was not being himself. He eventually gets diagnosed with sleep apnea, gets onto management with PAP therapy, and in a really neat way, he comes back in 2018, signs a $42 million contract with the Bucs at the highest paid center, and in 2021 wins the Super Bowl with Tom Brady. And so I think this just highlights an amazing success story and hopefully ones that we can help to assist, be able to have a longer career longevity, and also obviously for helping them be the best they can be, as well as thinking about their long-term health too. Okay, another useful tool you might want to consider is using the Athlete Sleep Screening Questionnaire, or ASSQ for short. This is a validated questionnaire to help identify athletes that need further assessment. So this is 16 multiple choice questions. It provides then a sleep difficulty score, or SDS, and as you can see, that goes from 0 to 14. It will help identify those that need additional assessment, whether by you as a sports medicine doc or referral referral to a sleep specialist. Specifically, it will identify those for sleep disordered breathing that will be valuable to refer to the sleep specialist, but also can help you identify issues with performance or sleep during travel, their chronotype that could also impact sleep, and then other aspects like napping, caffeine, and electronic use. Now, another way I want to arm you with is a way to talk to your athletes simply about their sleep habits and patterns when they come to see you. This is a acronym called SATED. So S for sleep quality on a 1 to 10 scale. A for alertness, how alert they feel in the morning and through the day. T for the timing of their sleep. E for sleep efficiency. So that's the amount of time they are asleep over the time that they are in bed. And that should be around 85%. D, sleep duration, and that is the SATED model. Obviously, you may want to ask also about difficulties, sleeping or concerns, and sleep aids or supplements. A couple other considerations that I would add on to it is the difference of sleep on weekends versus weekdays, as you might see a lot of variability between those patterns. How they're napping and how long they're napping. Asking about their sleep environment, which can really affect quality of sleep, and then also caffeine and alcohol consumption. Okay, so now let's jump into my 8 sleep essentials to sleep like a champion. I've highlighted here some of our Olympic athletes in past years who have been very vocal about how much they are sleeping. So we have Chloe Kim at 8 to 10, Michaela Schifrin around 10 hours, Lindsay Jacobellas at 10, Nathan Chen at 10, Shaun White likes to take the power nap. Okay, so here's some of my essentials. Number 1, you do want to really assess for sufficient sleep duration. We've already discussed 7 hours as that minimum for adults. There are those populations, as I mentioned, the elite athletes or young adults who may have this accumulated debt, and it could be valuable for them to be getting that 8 to 10 plus to pay back down that accumulated debt. Again, it takes more than one night, one weekend, but this is the populations in particular that could benefit from additional hours. Really, it is challenging to increase your sleep over, say an hour or two. And I wouldn't suggest that. Really aiming for this gradual 15 to 30-minute increase is going to be the best way to find success of increasing that duration. And so sometimes it's easier to shift the bedtime earlier slightly than it is to change the wake up time, as the wake up time can sometimes be limited because of school or work obligations or other factors at home if you have kids. And so sometimes it can be easier to suggest the bedtime to be shifted earlier, partnered with, for example, an alarm on their phone to help them be intentional about trying to make that bedtime. The one scenario where it also may not be as helpful, though, is if you have someone who is much more delayed in their delayed sleep phase, where they tend to go to bed later and wake up later. It can be challenging in that group to do the earlier bedtime. Okay. Now you might say, who does this? I made this infographic over a decade ago, but even at that point, there was a number of pro athletes that were vocal about the importance of having this foundational sleep. Roger Federer said he would get 11 to 12 hours. Usain Bolt said 8 to 10 hours. Lindsey Vonn was advocating for 9 hours. LeBron said he would get 12 hours of sleep at night. I believe he breaks that down into about a 9-hour night and then a 3-hour power nap. We have Nadal, who said he would get around 8 to 9 hours. So there are a fair number of athletes that have been vocal and really emphasize that this is critical for them to be at their best and really need this each day. LeBron is someone who spends supposedly about $1.5 million on recovery every year. And I think it's so fascinating that he says one of his biggest priorities is the recovery modality that is free, and that is sleep. And he says it's the best recovery you can possibly get is when you're sleeping. Okay, number 2 as my essential is to pay back accumulated sleep debt and then leverage sleep extension. So what that means is that when you build up that accumulated debt, think about like a credit card, you should pay it back, but it can take more than, again, that one weekend to make a significant dent in your sleep debt. Some colleagues have looked at even 1 week of sleep extension, have shown that that's had a 6% increase in tennis serving accuracy. I at Stanford had looked at the men's basketball team and showed that there was a 9% increase in free throws and 3-point field goals after 5 to 7 weeks of sleep extension. Now, if you remember Andre at the beginning of this talk, he had that 9% increase in free throws. So it was really neat to see, even though it was just one person, he replicated the study that I showed in the men's basketball team at Stanford too. All right. Now, how long should it take to fall asleep? This is my next question. Do you think it should be under 1 minute as soon as your head hits the pillow? Is it 5 minutes, 5 to 10, 10 to 20, 20 to 30, 30 minutes? How long should it take on average for you to fall asleep? I'll give you 10 more seconds to take a guess. Throw it in the chat. Think about it in your head. All right, I have a D that is thrown out there. Let's see if there's anyone else. I see a C. Okay, so the answer is 10 to 20 minutes. I think a lot of individuals think that they should fall asleep as soon as their head hits the pillow, but that's actually not the goal. If anything, that actually means you have a substantial sleep debt that's been accumulated. And so, I'm not going to spend too much time on what you have heard of, and I'm sure other talks about good sleep hygiene and sleep habits, but this is just going to be a very quick review because these do impact both the quality and also your sleep schedule or your sleep timing. So in a nutshell, we recognize that morning sunlight is so impactful because it really helps to lock in your body clock. So making sure your patients and your athletes are getting morning sunlight in the morning time is important. Reducing caffeine and alcohol, making sure there's regular exercise during the week, minimizing liquids before bedtime. The evaluation of meals and the timing of meals can be important, especially if they're having an earlier meal, as for example, dinner earlier in the evening time. So a pre-sleep snack could be considered so that they're not waking up. As I've had a recent athlete wake up at 4 a.m. to try and fuel because he's hungry and then isn't able to fall back asleep or fuel properly in the morning. Prioritizing time to process racing thoughts prior to bedtime. A racing mind is so common with many athletes. And then partnering that with having a regular relaxing wind down routine. Of course, many of folks are plugged into a lot of the electronics before bed, so trying to minimize that an hour before bed, and then dimming light before the evening time. And then from a sleep schedule standpoint, wanting to make sure that they have a regular sleep schedule, including on the weekends, so that you don't give yourself social jet lag, where you are not actually changing time zones, but you also feel the symptoms of jet lag by shifting your schedule. So these are things that can affect your ability to fall asleep, as the question before was asking, but really also, affecting the quality and just such a critical part to make sure that you're addressing with each athlete. Okay, so here's the next case. We have a 25-year-old female soccer player who reports difficulty falling asleep the past 3 months, particularly after night games, and takes 1 to 2 hours to fall asleep. Before sleeping, she watches TV or texts on her phone. She often lays in bed for hours, unable to sleep, and is very fearful she won't play well the next day. She sometimes uses Benadryl to help her fall asleep. So do you either A, prescribe her Ambien? Do you give her instructions to stop watching TV? C, do you instruct her to shift her bedtime later by 2 hours? D, instruct her to switch to Benadryl, from Benadryl to magnesium, or E, refer her for cognitive behavioral therapy for insomnia. So go ahead, take a guess. This is obviously which of the best case answers, because you could do all of these things. I see a B. Anyone else have a guess? Okay, I see an E. All right. So here, I did highlight that this should be referred for cognitive behavioral therapy for insomnia. I think all of these answers definitely could be used and if done appropriately and are important. We've already talked about some of the sleep hygiene, that you can stop watching TV. There is some value potentially if she has delayed sleep phase to actually shift her bedtime at a later point. There is a time and a place for prescription sleep aids, but really, I just wanted to highlight that beyond the sleep hygiene that's incorporated into cognitive behavioral therapy for insomnia, this is our first line for anyone that has clinical insomnia, and particularly this has been going on for 3 months. And it also incorporates restructuring of her schedule if that is needed, as we talked about potentially this C option, as well as stimulus control, what she's doing when she's in bed, and then how she thinks about her sleep too. And so these are all components of cognitive behavioral therapy. And I highlight this because it really is our first line therapy. All of the prescription sleep aids and over-the-counter supplements or over-the-counter sleep aids are all really second line because the evidence is not very strong that they really are that impactful. So just wanted to highlight to use CBTI for the athletes that continue to really struggle with their sleep. One way to assess their insomnia is the Insomnia Severity Index, and this is 7 quick questions that then provide a total score that will then give you some sense of the level of insomnia that they're experiencing and can track over time. So as I mentioned, CBTI is our first line. Sleep aids really have weaker evidence, and so they are all our second line management. I get questions about magnesium a fair amount. Generally, I am suggesting to supplement through nutrition and diet first. There isn't strong guidance from our national organizations that magnesium specifically will benefit sleep. And while melatonin is something that is incredibly common, the benefit really is only about 7 or 8 minutes to fall asleep faster when you look at the meta-analyses. There's stronger evidence is really when you're shifting the body clock, particularly when you're traveling eastward. Of course, with elite athletes, we need to be mindful of the type of melatonin that's being used. And I always recommend just NSF Sport certified melatonin if that is something an athlete is using. We want to avoid regular use of Benadryl, Unisom, ZQuil, the over-the-counter sleep aids. There's a suggestion that obviously these anticholinergics potentially could be at higher risk with chronic use for early dementia, so it's not really our favorite go-to. And even something like Ambien, where there is a time and a place for it, the benefit only suggests really 5 to 12 minutes faster to fall asleep than a placebo. Okay. Another tool you can consider using is called the Athlete Sleep Behavior Questionnaire. So this was a questionnaire that I helped to develop a couple years ago. We looked at 18 different sports across 9 different countries, really to develop a practical tool for practitioners and researchers to be able to look at sleep behaviors and be able to track that over time. So this is an 18-item questionnaire. And this is what it looks like. You get a point in the never to always category, and then you add up the total categories. And really, these are ways that they do distinguish between athletes and non-athletes, and also identify places for intervention that again, the practitioner or researcher could utilize easily. Now, with Paris coming up, I've had an opportunity to work with a number of Olympic hopefuls, and you know, some of the things that come up in looking at towards Paris is not only thinking about your sleep environment, so Olympic Village, but obviously also what does it look like for your travel plans and what are you doing to think about your competition time? Now, in Olympic Village, I bring this up because our environment is going to be also so important to think about how to optimize to get the best sleep possible. Interestingly, in Paris, there's supposedly no air conditioning in these bedrooms. So the question I asked them is, well, what are we going to do to manage that temperature when you do get there? As you can see, there currently is a fair amount of construction here, and so it's on potentially a busy street. How are we going to manage light and noise? Are you going to bring tools with you so you can better optimize this situation if there's unintended noises and light that are present? You know, are you going to be comfortable on this bed? Are you thinking about that sleep surface or the bedding and the pillow? And really, who are you also going to be potentially sharing a room with? Are they on a different type of a sleep schedule? Do they have different habits? And how is that going to play out when it gets to, you know, the biggest stage of your career? Then we think about the travel. So do you have a plan around pre-flight, in-flight, and post-flight strategies so you can minimize jet lag and make sure that you're as synchronized to the Paris time zone as quickly as possible? And then thinking about, too, where you're going to have to travel from. Many of the Olympic teams are going to be training in other locations for training camps prior to the Olympics. So thinking about those travel plans as well as those different sleep environments can be important. And then, of course, when are they competing? So are they competing in the morning, in the evening times? When are they used to competing? And how does that line up also with their current practice schedules? We want to think about their own chronotype. Are they, morning larks versus evening owls, and when their daily peak is going to occur, to try and strategize around the best way to manage it when they get to Paris. So these are things that have come up in conversations with Olympic athletes, but all things that I think are applicable to the conversations that you have with your athletes, even day to day. Now, maybe they're not an Olympic village, but it's also thinking about what are they doing to make sure that their own sleep environment at home and for on the road when they're, say, in a hotel room, what are they doing to optimize that environment? So that's my number 5 essential, which is optimize your sleep environment and leverage various sleep tools. So making it really dark, quiet, cool, and comfortable, like a dark cave, is going to be huge. To make it dark, blackout curtains and eye mask are incredibly helpful. When I've looked at a professional sports team, even this year, about 36% of them say that light really impacts their sleep. For it to be quiet, I do like having athletes travel with earplugs or even a white noise machine. There's smaller ones that are easy to travel with, or there's ones that are also adaptive. And so it actually senses sound in the environment and temporarily increases the volume and then decreases it once the disruption ceases. When I've looked at this, and again, this professional sports team recently, about 57% of them said that noise really impacts their sleep. And then when we look at cool, a fair amount of athletes all really complain that they are often very warm in the evening times, especially if they're playing night games. So 79% of this professional team said that temperature is a big factor that they often struggle with. 60 to 67 degrees has been the range that's been looked at in some studies. And while that seems very cold, I do suggest just decreasing your temperature about 1 degree every few days so you find the temperature that's right for you. Now, there's been newer technologies that have come out to help regulate, for example, your mattress temperature. So there are these cooling pads that can actually drop the temperature down to, for example, 55 degrees and give more control over your ambient and your mattress temperature. And of course, you need to be comfortable. So you want to think about evaluating your mattress, your pillows, and your bedding. I also often suggest thinking about allergy management. We're in the springtime right now, and allergies can very much also impact individual sleep. So making sure that allergy control is within the conversation as well. Here, I also just show an image here where I think a lot of folks don't have really great sleep positions. They put their head on the pillow and you have this obtuse angle here, which is not going to be great for sleep when you're on this for about 8 hours at nighttime. You really want to have that neutral position. So thinking about conversation about finding an adjustable pillow and one that can actually better support a neutral spine and neck position. Okay. I also, number 6, now suggest building a travel sleep kit. So in these travel sleep kits are, I put eye mask, curtain clips, light blocking stickers, earplugs, that travel white noise. I have a journal and a pen so that athletes can have a way to actually wind down and offload their thoughts from the day and plan for tomorrow. Chamomile tea, lavender spray. There's, as you can read, a number of things that I built out in these travel sleep kits, and they've been incredibly helpful so that when athletes are on the road, they have these tools readily available if there is a non-ideal sleeping environment. I've shared some of these down here for you. If this is at all interesting, just email me, or I put a QR code here to be able to see some of the ones that I suggest. But they're just examples of what you can build to have your athletes have the tools at hand when they need them. Okay, number 7 is to consider tracking your sleep patterns. And this can either be by a sleep monitor, as wearables have obviously become incredibly prevalent over the last decade, but it could also be as simple as a sleep journal. Now, I've shared this image here, just the confidence that we have with wearables overall. Now, in 2024, we generally recognize that many of the total sleep time, bedtime, wake time, those we have more confidence in versus, for example, where there's less confidence is definitely with the sleep staging or some of these recovery scores. And so this just gives you an idea of how to utilize these wearables, where they can be helpful to connect the dots from what happens at night and then how it impacts performance in the daytime. And to be able to look at these trends over time, over weeks to months, is really what I suggest using them for. To bring you up to speed, in May 2018, the American Academy of Sleep Medicine did put out a position statement really to underscore that these can be helpful tools to enhance the conversations with clinicians around an individual's sleep. But of course, it's not meant to replace any diagnostic instruments, and there can be wide ranges of, validity, and it could have unintentional consequences. So for example, some athletes can get very fixated on what those recovery scores can mean, and it can almost backfire in the sense that they get more they have more anxiety around their sleep by utilizing these wearables on a regular basis. So if used appropriately, I do think that they can be helpful as a tool, but just is, like I mentioned, a tool in this conversation around their sleep. Okay, now Patrick Mahomes is someone who has shared about his sleep, and I just have put up here some of his season highs. These are not averages, but he has been open about the importance of sleep, and you can see the difference of 2021 to 2022 and some of his max season highs, but he is someone who makes it a priority to get a lot of sleep under his belt. If you didn't know, I thought it was interesting, the past Super Bowl this year where the Niners versus the Chiefs, and the quarterbacks in particular were both advocates of sleep. So we've just talked about Patrick, where he will go to bed around 9:30 to 10, wake up around 7. The off season, he gets around supposedly 11 hours, versus Brock Purdy, who says that this is a new thing that he's been really focusing on as he's transitioned into the NFL. And he made it his number one priority heading into surgery. So he tried to then get 9 hours of sleep, and said it had a tremendous benefit in terms of how alert he could be during meetings, to remember the playbook. And he said it was just this night and day difference this year. All right. Okay, so next question is, how long should I nap? Do you think it should be under 10 minutes, 10 to 20, 20 to 30, 30 to 60? Take a long nap at 1 to 2 hours. Go ahead and take a guess. I see a B in the chat. I'm sure all of us have done every increment of these various lengths at some point in our lives. Okay, if there's any other guesses, or take a guess and keep it in your head, the answer here is really 20 to 30 minutes. That will give you an alertness and performance boost for about 2 to 3 hours. Now, what's interesting is in a professional sports team I looked at this year, about 29% of them don't or rarely take naps. Of course, this can depend on perhaps the sport and when you're playing games, but we do recognize that the afternoon period between 1 to 4 is going to be great, going to be a good period where you can try to take a nap, where you have a dip in circadian rhythm. And so it's easier to take that nap in that interval, especially if you're playing night games. And this can also give you a boost prior to that evening matchup. If you take the longer naps, what happens is you can feel that sleep inertia, where you have that sluggishness and feel more tired. And you can wake up from deeper stages of sleep and feel that sleep inertia. And that also can impact your sleep the subsequent night. And so really you want to cut down those really long 2-hour naps down to hopefully 20 to 30 minutes. If you're someone who struggles with sleep at nighttime, then for those athletes, we just say don't nap at all, and just increase throughout the whole day. Make sure that your sleep drive is as high as possible. Okay. You could also try the Nappuccino. So this is where you take caffeine, where it's your favorite energy drink, cup of coffee, you name it. Caffeine will take about 15 minutes to take effect. And then you go to take your 20 to 30-minute power nap, and then bam, you wake up and both the caffeine and the power nap will have kicked in. And there's studies to suggest that this is actually more effective as the combination than either taking a nap alone or taking caffeine alone. Okay, now all these together, now you have these 8 essentials, and you could develop a plan around sleep for your athletes. I think each of us can do this as a sports medicine doc. I think you're fully armed now to have some understanding of how to assess and have these conversations and to set your athlete onto a sleep performance plan. Now, I have developed a sleep journal to help athletes to be intentional. So if this is helpful, then definitely this can be another resource for them. I have them think about a goal each month. And so that is one area that they want to improve from a daytime functioning standpoint. And that'll drive their desire to be able to address the sleep, because obviously we know that it's interconnected. I have an area, there's an area here so that they are intentional about putting their sleep goals for the week and able to track that over the week. And then also on a day-to-day basis, there's a practice so that they have a place to process their thoughts and journal, as well as write a to-do list. And so this becomes hopefully a tool that many of my athletes have started to be able to be intentional about their plan and to be able to monitor that for themselves in the interim from when I see them. Okay, now bring this back to Andre. You know, he started to change his habits. We changed how he approached his sleep, what he did before bedtime, his sleep environment, cut down his naps. We looked at, you know, some of his nutrition interventions. And he said the sleep was helping me so much and it changed everything for me. In a very neat way, that next season, Andre went to the NBA Finals. That was when the Warriors had their first championship. He came home with the Finals MVP. And in a really neat way, since then, he's had 3 additional championships since. Now, that's 10 years longer of a career since we started working with him back in 2014. And he's been very open about his sleep story. And so while there's a lot of things that go into it, you know, I really do think that having that foundational sleep under his belt for the remaining 10 years was hopefully part of helping him to be at his best for as long as possible. Okay, so here are my take-home points. Number 1, I hope I've able to share with you that it's about sleep duration, but also about sleep quality, and the timing of sleep are critical for peak performance and for healthy sleep. So these areas are ways that you can start to develop a sleep performance plan with each of your athletes. Number 2, encourage your athletes to think about paying back accumulated sleep debt and then leveraging sleep extension. It, again, likely is going to take more than that weekend or even maybe 1 week of sleep extension, but encouraging them to do so in small, gradual changes. So even 15 minutes more of sleep daily can make a difference. Number 3, establish a referral sleep clinic and a sleep specialist as part of your care team. I think this is incredibly important so that you have a smooth workflow to have your athletes be seen appropriately, and then have follow-up with a clinician, and just make that as part of your care team for your athletes. And then number 4 is optimizing your sleep environment. Think about investing in sleep tools that can be used both at home and while you're traveling. Think about suggesting building a travel sleep kit. And then lastly, just to be proactive about sleep. I think many athletes are, as I mentioned, very reactive to their sleep. And it's just the last thing that happens whenever it happens at the end of the day. But again, I've tried to challenge you to think of sleep as not the end of the day, but really what you invest into your sleep, and prioritize that as part of your evening period. It's going to be the start of how you feel and function and perform tomorrow. So some resources I'll leave with you here is the National Sleep Foundation is an excellent group that has information on a broad range of topics. They also have a poll that comes out once a year on various sleep topics that you can dive into if you're interested in, for example, sleep in teens or technology use and sleep. The American Academy of Sleep Medicine is one of our national organizations. You can go there to see the latest research and the latest consensus statements. The Promise of Sleep is by my mentor, William Dement, over here. This is his book. It was published in the early 2000s, so it doesn't have necessarily the most updated, but he is considered the father figure of the field, and this is a great book by the pioneer himself on getting the basics of sleep. If you're interested in hearing more about Andre himself and some of his sleep success story, then there's a Time for Health talk that we did And also, if you want to hear a bit more, I have a Nike Train podcast or other types of webinars and Goodreads. Or if you're interested in some of those sleep tools, as I mentioned, feel free to email me or message offline. So I'll stop here. I'll leave my contact information below. You can follow me on Twitter or Instagram. I've also put QR codes here in case that's an easier way to access. But in short, right, sleep is so foundational for us to be our best. And it is often hard to really understand how insufficient sleep or even a poor night's sleep might impact us. But the bottom line is that we really need this fascinating process to be cognitively, physiologically, and physically at our best in whatever we do, whether that's even just getting to work safely and driving or making important decisions under pressure. So with that, I hope I've given you now some practical strategies and tools to be able to talk with your athletes about sleep and how to set them on a plan for improving it with very practical and gradual changes, as well as I hope that you've taken away something today to improve your own sleep. So with that, I say thank you and sleep well tonight.
Cheri, Dr. Mah, thank you so much. Great talk, phenomenal information for all of us as physicians and also the athletes for which we care. At this point, if there's anyone who wants to put any additional questions in the chat, or if they want to unmute themselves and ask Dr. Mah directly. One thing you did mention I wanted to ask was about melatonin. That's a supplement we get asked about. Is there a dose of melatonin? I know there have been some studies saying if you had taken too much melatonin, it can actually interfere with sleep. How do you explain melatonin supplementation other than sort of that additional sort of 7 to 8 minutes that it can maybe add?
Sure. So with melatonin, like any supplement, it's not FDA regulated. And so obviously there can be a concern of how much is actually in the supplement that you are taking. There was a study that showed the wide variance between various supplements of what was in what was supposedly on that label. And that was, obviously sub what was stated to as high as over 400%. And so just being mindful that there's going to be that variability. In terms of dosing, we often recommend smaller doses of 3 milligrams or less. You don't need those higher doses of 5-10 milligrams. We do use those very high doses, but they're for very different types of clinical sleep disorders, not in the typical desire just to fall asleep faster in your one time zone. So I would say stick with 3 milligrams, or even you can go down to 1 milligram. Some of the studies, when we look at shifting that body clock. So for example, when you have an adolescent who has that delayed body clock where they're going to bed much later and waking up much later, if you're trying to shift that, the doses are much smaller, of even 0.3 milligrams and taken 4 to 5 hours before the typical bedtime. So that's a different scenario where you're using melatonin, but also a different dosing. So all goes to say that you just don't need those mega doses that are readily available.
Great. And then one question we have in the chat, how do you advise your individuals who fall asleep well, but then wake up early and struggle to get back to sleep? And then there's a second part to that question. Can you speak to trazodone specifically as a sleep aid?
Sure. Okay, I'll take the second part. The trazodone. So I know a fair amount of providers, especially primary care docs, they often will use trazodone as a aid for sleep. And I will say, often it's used because there's, comorbid depression and are using it for that, with that side effect of kind of being more sleepy. And so that's where it's utilized. I would say just using trazodone simply for a sleep aid is probably less recommended. It's not supported by our national guidelines to use trazodone specifically. So it's not particularly my favorite go-to sleep aid. I will say, for the question about advising individuals who fall asleep well, but then wake up early and struggle to get back to sleep, this is, a place where you have to dive a little deeper into why are they waking up. There's a number of factors that can cause someone to wake up in the middle of the night and then struggle to get back to sleep, right? Is this, they have a very shifted sleep schedule and they're waking up because of that very variable schedule, and their body doesn't know when it typically is waking up or was shifted recently from travel. Is there substances like alcohol that they had on board previously? Alcohol will really fragment your sleep and cause those awakenings in those early morning hours. Caffeine, obviously, if they're having caffeine late into the evening, I have a closing picture, taking caffeine at 9:30 at nighttime. Obviously, that can also affect their sleep subsequently. Is there environmental disturbances, whether it's light or sound or temperature? Those can cause disturbances and awakenings during the nighttime. Do they have an underlying sleep-related breathing disorder? Do they have apnea where, again, apnea is its worst in REM. Those early morning hours is when you're going to have more of those awakening periods. So there's obviously a lot to dive into to better understand what's occurring and why someone might be waking up. But that's at least a starting point to think about the various buckets to discuss.
And then another question from the chat. Any online resources for accessing CBT to improve sleep?
That's a great question. There is a large need for more CBTI providers than I think is often available. There's unfortunately very long wait times at times for CBTI providers. So there have been some apps that have been developed to provide CBTI. There have been also, I would say, thinking about other providers in your local area. Sometimes those wait times can be also shorter than seeing someone through the typical affiliated clinic. It's a challenge because we really need to have more available resources for those that struggle with insomnia. But I would say, yeah, the apps have been the one that has been helpful for some.
You had mentioned sort of sleep quality, right? Sleep duration, and then you mentioned sleep timing. Can you speak a little bit more about, I know there's been some research saying that it's better to have a consistent bedtime and wake time versus bopping up and down. Just if you could maybe comment a little bit more on the sleep timing component.
Yes, great. So sleep timing or sleep schedule, the recommendation is to have the same bedtime and the same wake up time every day of the week, including the weekends. And really it's because our bodies are quite sensitive to even small adjustments, right? You imagine in daylight savings times, we shift a whole hour and we feel the effects of even that hour. So even smaller increments we're sensitive to. So that is why it's helpful to have the same bedtime and wake up time to lock your body clock in. And that can also help to trigger your brain and your body to anticipate when you need to wind down and when you actually are preparing to get into a state and a mindset that you're ready to sleep for the nighttime. What's challenging is that a lot of individuals will have a large window of bedtime. So they'll go to bed anywhere between a 2 to 3 hour window, right? From 10 p.m. one night, 1 a.m. the next day, midnight the next day, and they wonder why it's challenging to fall asleep. Or same thing on the end of the wake up window. Sometimes they'll wake up early, sometimes they'll wake up a lot later. And then it is, they experience sometimes those early morning awakenings or difficulty having that consolidated sleep. And so you really do want to lock in on a same bedtime wake time, or if you do shift it, try to have a more narrow window. So ideally, less than a half hour or no more than an hour time frame. On the weekends, when a lot of individuals will stay up later and sleep in later, that is, as we quickly discussed, social jet lag, where you can feel the effects of shifting, almost a 2 time zone. It's like as if you got onto an airplane, went 2 time zones, and that's how you felt, because you can feel that sluggishness when you wake up. Sometimes you might feel off or some GI upset, or you don't feel great in terms of your alertness levels at the right time because you've shifted that schedule. And then it makes it challenging to go back to your original schedule when it comes to, say, Monday. So ideally, you want to keep on that same time. And I know easier said than done. I do suggest setting an alarm on your phone to at least remind yourself you have 30 minutes to wrap up your day and keep you locked in so you can actually try to hit the target bedtime that you really are aiming for.
Excellent. One more question from the chat. There's a question about having patients take either CBD and or THC, that a lot of patients now are coming and using this as a sleep aid. Is this safer than alternatives like Ambien or benzos, which have potential behavior forming issues?
It's a good question. And as you can imagine, this is something that comes up with athletes also a fair amount. So I think the evidence is still ongoing in terms of really the effects of THC and CBD. And there's some of the earlier studies that have shown where there could be potentially acute benefits of using CBD, for example. Where it can potentially help some fall asleep faster and decrease awakenings at nighttime. But then what's interesting is the chronic use. Some of the studies have suggested, I believe it's around 3 months for at least 3 times a week. Then you see the rebound effect of reversal. So now it's harder for people to fall asleep. There's more awakenings during the nighttime. And then it also affects REM and deep sleep, differently at that point. And so not only do you think about the acute and the long-term effects with chronic use, but then also like the rebound and the withdrawal effects too that can happen within 24, 48 hours of it. Then there's the question of how much, ratio of CBD to THC is there really in what you're using, then the dosage, and then also the formulation. And so I think this is a challenging area where I have not strongly recommended utilizing CBD or THC or in lieu of prescription sleep aids when needed on a short-term basis. But I do recognize it is incredibly common, and especially with some of the athlete population that at least I've seen in my recent experience. So I think more to come. But I think that there's other ways to hopefully have conversations around how to make adjustments in their lifestyle behavior modifications while also maybe considering a short-term aid if needed.
Great. Thank you so much, Dr. Ma. And thank you for sticking around to answer a lot of the questions. At this point, I think we're going to wrap things up from here on the East Coast and from you on the West Coast. So thank you very much again. And thank you for everyone who tuned in.
Thank you. Sleep well.